Excruciating, like a hot poker stabbing into flesh. Worse than having a baby. Just a few ways women have described having an IUD or an intrauterine device inserted and removed.
It was a type of pain I really hope to never feel again. It was toe curling, like white knuckle pain. It was one of the worst experiences I've ever had.
IUDs are a common form of contraception, a small T-shaped device that sits in the uterus and can prevent pregnancy for up to 10 years. Women say they are told to expect discomfort during insertion. Many instructed to take over-the-counter pain relief like Panadol. For patients like Kaylee, discomfort didn't begin to cover it.
I was told that it was only going to be essentially similar to period cramps, just a little more close together. If the doctors had told me how much pain I was in for, I wouldn't have done it.
Now, a Melbourne hospital has become the first public clinic to offer a green whistle during the procedure, a fast-acting inhalant painkiller often used in ambulances.
I was really scared, thinking I had to go through the entire procedure again. And when they told me that the green whistle was an option, I was a little sceptical at first, but went through with it anyway. It was a game changer. It made it so that I can safely have an IUD and not have to go through excruciating levels of pain.
Female patients are no strangers to battling the medical system to have their pain heard. A recent study surveyed 3,000 women with endometriosis, revealing more than half had been advised to fall pregnant as treatment, some as young as 13.
The fact that the idea of creating a whole other human is even raised as a potential treatment option is outrageous.
That's after many struggle to even be diagnosed with endo in the first place.
When I expressed pain to my doctors, I was made to feel as though it was normal or in my own head, and it wasn't until they actually cut me open and found the endometriosis that it was taken seriously. So I think we have a way to go for doctors to realise that there's a problem, and then a way to go in terms of what the treatment options are.
Well, Gabrielle Jackson is the author of Pain and Prejudice, which explores how female pain is viewed and treated. Gabrielle, this is obviously about something much bigger. What do you think it is that's at the core of female pain being misunderstood?
Well, the short answer, Hamish, is that medicine actually knows very little about women's health because they've never really studied female biology.
Wow, seems to make sense. Are we getting any better?
I mean, I would like to say more, but that's the long and short of it. It seems unbelievable, but almost everything we know about human health comes from the study of men and male animals, and even male cell lines. And even today, money given out by the Australian Medical Research Fund can go to studies that don't include female animals. Now, there's a lot that you can't take from the study of male animals or even men and apply it to women. And the thing we know about pain is that it's actually experienced differently in the female brain. So there's basically all the studies that have ever been done on pain are useless to half the world.
That's something I guess I am trying to understand about this. I don't have experience of pain as a woman.
Give it a go.
How different is it? Why is it different?
Well, that's the big question that we should know, but we don't, and that we need to understand. A lot of people think, look, when it comes to acute pain, like when you break your arm or you burn your finger, medicine understands that, and that's pretty similar experience for men and women and other people. But in chronic pain, which is when you have pain for more than 3 months, that's really much more prevalent in women, and it works really differently. And they think it's something to do with the immune system and inflammation, because we've known for a long time that female immune systems work different to male immune systems. That's why way more women have autoimmune conditions. And they now think that there's something going on in the immune system that's also influencing pain.
Gabrielle, it seems like that sense of timeliness is important, because it's great to see a step forward like this for IUD insertion. I feel like maybe it could have come a little bit earlier. Are there other common procedures that women go through without appropriate pain relief?
Yeah, I mean, there's hysteroscopies as well. Like, you know, anything that has to be put through the cervix. Now, there's probably a time where I couldn't have said cervix on the news, but I'm going to say it. Anything that has to go through the cervix is going to be really, really painful. And I'm not going to swear, but, you know, I've had an IUD inserted and it was not fixed by an ibuprofen. Yeah. Other people have had it and told me it's absolutely fine, but there should be an offer of some kind of pain relief.
Gabrielle, I suppose part of me finds it difficult to believe that the root cause of all of this is just medicine not listening to women. That seems such a ridiculous idea, I suppose, from the outside. Is there more to this?
It is a ridiculous idea, Hamish, and the problem is the lack of knowledge. We just don't know what we don't know. And there's this really pervasive idea in medicine of the hysterical woman. Now, in medical school, they're not trained about what they don't know. And so that's the kind of awareness that I think needs to change. The limitations of medical knowledge need to be part of the medical education.
Yeah. I mean, we should introduce them to Nick Cody when he's got a cold, because that's actually hysterical.
Yeah, I'm still getting over it. It was August.
Yeah.
I hope by January I'll be all right.
Yeah.
Thank you.
You know,
Thanks for checking. Give me a green whistle. That'll sort it.
The really interesting thing is that because women have stronger immune systems and more flexible, which turn on them, that sometimes man flu can be real because they experience some
Cut the interview.
conditions
Cut it.
One for the boys.
Cut it.
Yes.
Cut it. We're losing Gabrielle.
Yes.
Can we get the green whistle then for man flu?
Cutting it.
The apple vape.
Gabrielle,
You're dropping out, Gabrielle.
thank you very much for your time tonight. Really appreciate it.
Great to be here. Thank you.